Have you ever been on your way to an important interview, a big presentation, or even just stuck in traffic, and suddenly you feel an overwhelming, urgent need to find a restroom? It's not just a little discomfort. It's an urgent, almost panic-inducing sensation, even if you just went 10 minutes ago. Perhaps you've noticed it happens most when you're feeling particularly stressed or anxious. If this sounds familiar, you are absolutely not alone. Today, we're going to talk about a very common yet often misunderstood connection, the link between anxiety and frequent urination. It's a topic that many people experience but might feel embarrassed to discuss, or they simply don't realize how deeply connected their mind and bladder truly are. What we'll explore isn't just a fleeting feeling, it's a genuine physiological response rooted in our body's ancient protective mechanisms. We'll demystify why it happens, unpack the cycle that can keep it going, and most importantly, discuss what really helps. So, why does our bladder seem to go into overdrive when our minds are racing? The answer lies in our body's incredibly sophisticated, yet sometimes overzealous, stress response system, what we commonly call the fight or flight mechanism. Imagine your body has an internal alarm system. When you perceive a threat, whether it's a growling bear or the stress of a looming deadline, this alarm sounds. Your sympathetic nervous system kicks into high gear, preparing you to either confront the danger or run from it. This is a very ancient, primal response designed for survival. When this alarm goes off, a cascade of changes happens throughout your body. Your heart rate increases, your breathing quickens, your muscles tense up, and interestingly, your bladder becomes much more sensitive. Think of it like turning up the volume on your bladder's fullness signal. Normally, your brain might only register the need to urinate when your bladder is quite full, but under stress, that signal gets amplified. Even a slightly filled bladder can feel like an urgent, overwhelming need to go. This heightened state leads to a few key physiological changes. First, the nerves involved in bladder control become far more responsive. They start sending urgent messages to your brain much more readily. Second, anxiety often causes muscle tension, and this includes the muscles of your pelvic floor and those surrounding your bladder. When these muscles tense up, they can create a sensation of pressure or fullness, making you feel like you need to urinate even if your bladder isn't actually that full. It's a very real physical sensation, not just something you're imagining. Some theories even suggest that this response has evolutionary roots. In the wild, lightening your load, essentially emptying your bladder, might have made you more agile and quicker to flee from a predator. While we're not typically running from bears in our daily lives, our bodies still respond as if we are. Now, here's where it can get tricky, creating what we call a vicious cycle. Anxiety triggers frequent urination, but then the worry about needing to urinate frequently, especially in social situations or when you can't easily access a restroom, actually increases your anxiety. This heightened anxiety then further exacerbates your urinary symptoms, leading to more worry, and so on. It becomes a self-reinforcing loop that can feel impossible to break. This cycle is a significant reason why this issue can be so persistent and distressing.
This connection is so strong that anxiety is recognized as a significant contributing factor to conditions like overactive bladder, or OAB, which is characterized by sudden urges, frequent urination, and sometimes even accidental leakage. Frequent night waking to urinate, known as nocturia, is also commonly associated with anxiety and depression. It's not just a symptom, it's often an integral part of these broader conditions. And for those wondering if there's a deeper biological link, research actually suggests shared pathways in the brain and body. Our serotonin systems and the stress response axis, known as the HPA axis, are implicated in both anxiety and bladder function. So it's not simply a psychological quirk, there are real neurobiological underpinnings. One of the most important things to understand is that bladder issues are not simply a normal and inevitable part of aging. While they can become more common with age, they are often treatable. This misconception often leads people to suffer in silence, believing there's nothing that can be done. Another critical point is the importance of ruling out other medical causes. Before attributing your bladder problems solely to anxiety, it's essential to consult a healthcare professional. Conditions like urinary tract infections, diabetes, certain neurological issues, or even bladder stones can cause similar symptoms and need to be ruled out or treated appropriately. A doctor can help differentiate between these and anxiety-related bladder issues. So, what can you do if you find yourself caught in this anxiety urination cycle? The good news is that there are many effective strategies and resources available. First, addressing the underlying anxiety is key. Mental health professionals, such as psychologists or therapists, can be incredibly helpful. Techniques like cognitive behavioral therapy, or CBT, are highly effective in managing anxiety, by helping you identify and change unhelpful thought patterns and behaviors. Dialectical behavioral therapy, or DBT, can also offer valuable coping skills for managing intense emotions and stress. Beyond formal therapy, everyday stress management techniques can make a big difference. Things like mindfulness meditation, deep breathing exercises, regular physical activity, ensuring adequate sleep, and reducing caffeine or alcohol intake can all help to calm your nervous system and, in turn, reduce bladder sensitivity. You might also consider seeking out a pelvic floor physical therapist. These specialists can assess for muscle tension in the pelvic floor and provide targeted exercises and techniques to help relax and strengthen these muscles, directly addressing one of the physiological causes of urinary urgency. Of course, your general practitioner or a urologist is your first point of contact for diagnosis and to explore medication options if appropriate, or to refer you to the right specialists. They can help you create a comprehensive treatment plan that addresses both the physical and emotional aspects of your symptoms. In summary, that urgent need to urinate when you're anxious is a very real, biologically driven response, not just in your head. It's a part of our ancient fight or flight system, amplified by nerve sensitivity and muscle tension, and it can become a persistent challenge due to a vicious cycle of anxiety and symptoms. But remember, this is a treatable condition, and you don't have to suffer in silence. By understanding the connection, ruling out other causes, and exploring the various tools and professionals available, from mental health therapists to pelvic floor specialists, you can absolutely find relief. Taking that first step to seek help can be incredibly empowering and can significantly improve your quality of life. Be patient, be kind to yourself, and know that effective solutions are within reach.